योजना, National Urban Livelihood Mission, राष्ट्रीय शहरी आजीविका mission in Hindi. So just correction, so that the present time we are dealing with the day annual and the former scheme has been transformed. So I'll refer our mission, what we are doing and how we are, the very first slideshow by Inayat, the determinants of, health. So I'll focus on livelihood she has mentioned, like poverty she has mentioned, the education, health, indicators she has mentioned. We are from practice and we are practitioners and we are dealing day to day, life of people who are in the grit of poverty, who are marginalized, who are living at the other side of this, mainstream society. In our mission, we have key areas to work on. And like Mr. Saurabh Jain sir was sitting and he was sharing from the urban development perspectives, like we are also having a MOUD and MOHUPA tie-up. So very soon we have started working on health and poverty together, bringing convergence. So my first word to start with is convergence and education for sustainable development. In ESD, what we are trying, like in poor sections, poor people, when they enter into the circle of vicious circle, which is called as vicious circle of poverty, how they enter? No money. No money means no education, no health opportunities, no basic services, and this goes continuously for long, and you can call it like sometimes absolute poverty or say relative poverty. So maximum people who are, more than 30% of this country lives in poor people, accounts for poverty. So when we deal such people, and our government is, focusing on building, building their capacity through skill building, through other forms of education like SSA or Madhyamik Shiksha Abhiyan. So in capacity building, we do organize skill training programs for long, but this mission has given something different. They have gone for quality training, quality skill training, and beyond that quality skill training to certain hours, we have gone one step further at Chandigarh. We have gone for addition of 60 additional hours to the, the standard curriculum given by the ministry. And in 60 hours, what we did, we introduced, the educational pattern other than core skills, including health, including ethics, including insurance, including financial inclusion. I'll take you to one case study. I don't have a presentation right now because very late evening I have just confirmed to be here. So I'll take you to a case study. You just go to any slum, and I have some pictures in my mind. If I see some youth between 18 to 35 years, what they have, they are having either 10th or they are dropouts or they don't have +2. Because of their family environment, they could not continue the, graduation or say university degree programs. So they are somewhere between the, the school education. So we enroll them. Enrolling doesn't mean you just give them skill training in any of the field like IT or say tourism industry or hospitality industry. We found even if after having a skill development program, they do not have basic things like they don't know how to invest on health. They don't know why to go for health insurances. They don't know how to go for nutritional value. We found many people, those who were placed, those who were brought into the mainstream society, they even don't spend on their life for their family. They simply go to a shop or say branded showrooms like Reebok or Adidas, they simply purchase a pair of shoe or branded jean. This is their first priority. So once we come to know that this is not the solution like providing skill development and linking to the employment, but their life is still there. They are just making their monthly income in one go, spend in one go. So we introduced 60 hours of curriculum in addition to the core skill training program, including health, in which we have introduced HIV/AIDS awareness program, because these people are almost having a tendency to enter into unprotected sex, drug abuse, alcoholism. So we have introduced HIV/AIDS awareness program with Chandigarh State AIDS Control Society. We have introduced DOT, direct observation treatment therapy, under RNTCP program. We have introduced mental health program with Government Medical College and Hospital, Chandigarh Sector 32. And not only these ethics and these sessions, these awareness trainings, but also we have introduced one skill training program. We have identified another skill training program, caregiving program, because many people who are in need of care, but they don't have those standard or those qualified people to take care of such patients. So So we have introduced such training programs also, keeping in view the sustainability, the ESD, Education for Sustainable Development. We have introduced these programs, and these people are now in the market. And they are having, their saving bank account. They are making savings. They are supposed to go and enroll for the health insurance and the insurance announced under Prime Minister's program like JDY, Janani Swasthya Yojana, Jan Dhan Yojana. So we are pushing those people to go into a convergence model, including all sort of line departments, various other stakeholders, including, say, civil society organizations too. So in skill building, we have introduced such component, and we are trying, even School of Public Health we have involved, we are working together. We are working together. We have involved many times in various capacity building programs for those poor women. And like, from Gujarat, there was a presentation from Seva. I was referring, I have visited Gujarat twice. And we have learned from Gujarat many times, and including our mayor and councillors, we have visited them. We have formed area level federations. You see, women-based community organizations, like any other NGO. We registered them under 1868 Society Registration Act. They are full-fledged community-based organization, and they are taking care of community. They are taking development programs, schemes to their community. They are like the agents of change, or say catalyst of change. So they are taking our program to their doorsteps, and they are actually the monitor. You see, call them evaluator, you call them instigator. So they have made our program a top, because in government, procedural delay and staff crunch is one major issue. You cannot perform until you don't have a team, a big team. So these are our pillars of success, or you say a pillar which penetrates. They are a part of city level federation and goes for a membership up to 20,000 women. So we have involved women, and like sir was saying, Swachh Bharat Mission. Yesterday we have awarded 30 self-help groups, the presidents, who were declared as CHANDIGARH, and they have made a tremendous contribution in making the city ODF free, open defecation free, and we were in the list. And these SHGs are playing a big role in taking Swachh Bharat Mission, and we are going to gradually increase this SHG limit of 30 to, say, 100. So this is our target. The main, in summary, sort of time, so in a single word, I should say, convergence is the best mantra which we have learned and which we have practiced. Thank you.
Thank you very much, Mr. Trivedi. Definitely, and probably when we're talking about social determinants and the wide range of determinants that we have, there is no other option but to work together. That's the call. We're just about 8 to 10 minutes, and I'll reserve my comments for this time. I would rather open it to, if you have questions, the speakers, there are 6 speakers who spoke here. If you have concerns and questions and clarifications or observations to make, please go ahead. We'll go for tea at 3:40 and come back